The Home RN app is designed to streamline and support workflow for nurses visiting patients in the home, and is part of a suite designed to improve the daily work of individuals, teams, and managers through an intuitive, easy-to-use UI. Across all roles, these apps focus on dramatically increasing productivity of the care team by integrating with your EHR and other systems, and by leveraging existing IT investments. The apps provide insights for the healthcare team by leveraging enterprise data, analytics, and the unique capabilities of the iOS platform. Here, let me show you how it works. Let's say that I'm a home nurse tasked with visiting patients in their home after an acute care hospitalization. This is the login screen for Home RN, and I can log in here using Touch ID or my login credentials. Once I log into the app, I'm directed to this landing page, which shows all of my patients for the day on a map. I can see from this screen that my first visit is with Sean Rogers from 9 to 10 a.m. I get information on his condition, post-CABG follow-up, and his address. If I need to get directions to his house, I just tap on the orange marker with the number 1 on it. This will utilize the Maps feature of my device to show me how to get there. If I want to see my schedule for the day, I can tap on the clock icon up in the top right-hand corner of the screen. This brings me to the scheduling dashboard, which gives an overview of all assigned patients, appointment times, length of scheduled visits, and diagnosis. The information on this screen will update automatically throughout the day, and I can come back here at any point to check in. Once I understand my schedule, I'll tap Done and return to the landing page. Once I've figured out how to get to Sean's house using Maps, I can tap anywhere on the blue part of the screen to pull up information on his visit. Now I've pulled up Sean's visit summary. On this screen, I can see scheduling information for the visit, an overview of what tasks need to be completed, and Sean's visit history. I also have the ability to call or text him and let him know that I'm on my way. Once I've arrived at the house, I tap Start Visit. Once I tap Start Visit, the app pulls up Sean's visit card. From here, I can get a couple key tools and pieces of information, including a countdown clock, which will help me track the length of the visit. This visit's scheduled for an hour, so as I work through my tasks, I'll be able to manage how much longer I have, and I can remain on schedule. Another important feature here is at the top of the screen. Here we have the ability to call or text the care coordinator directly from this device. All I have to do to contact them is tap the phone icon or text icons below the name. Here we see below Mary Piepenbrink. In this view, I can see all of the active tasks that need to be completed during the visit. As I work through them, I just swipe left and mark them as completed or deferred. As I complete and defer tasks, they'll automatically move to the bottom of the list under their respective sections. And I can continue to work through my list viewing this. Now let's imagine that I've noted a concerning change in Sean's condition and decide that I need to call his physician. To do this, I just swipe left on the coordinator contact area at the top of the screen, and I'll see the relevant physician contact information. In this case, the patient's physician contact is his cardiothoracic surgeon. I can choose to call or text Dr. Stone directly from the device by tapping on the icons below his name. In this case, we'll choose to call him. With one tap, I've spoken to Dr. Stone, who decides to order a new medication. Now that I've received Dr. Stone's approval, I can come back and tap on the Health Resources icon, top center, to bring up a list of nearby health resources, including pharmacies where Sean can fill his new prescription. Using iOS location-based services, the app generates a list of pharmacies, urgent care centers, and labs that are close to Sean's home. This list could also be tailored based on plan or provider-approved resources. So after talking with Sean about where he'd prefer to have the prescription filled, I'll select VT Pharmacy. This takes me to a communication page with pre-populated physician, patient, and pharmacy information. Once I fill in the required information, a message will go to Dr. Stone. Now all he needs to do is call in the prescription for Sean to pick up. If for some reason Sean's unavailable or unable to pick up the prescription, I can just choose to add it to the map and I can go get it myself. To do that, you just select Add to Map. The location of the pharmacy is now added to the map and a notification has been sent to the physician. The next time I navigate to the map, the location of the pharmacy will be there. So now that I've changed Sean's prescription, I can go back to his visit screen and continue to work through the tasks. Once I've completed everything, I'll just go down to the bottom of the screen and tap End Visit. Before moving on to the next patient, I might want to map the pharmacy because I've decided to end up picking up his prescription. With a tap on the pharmacy icon, I can get directions directly there. Now I'm ready for my second patient, John Wida. Just as I get ready to head to John's house, I receive an alert from the home health coordinator telling me his visit has been canceled. I'll tap OK. The landing page now shows John as deferred in the bottom right corner. From here I can move on to the next patient, Suzanne Connolly. When I pull Suzanne's patient card up, I can tap on the bottom of the screen anywhere on the blue part, and I'll be brought to her visit page. Just like in the previous example, I can now see information on Suzanne's visit, on tasks that need to be completed, and on previous home visits. I know that Suzanne just got a knee replacement and has limited mobility, so I'll send her a text message letting her know that I'm on my way. The app presents me with a list of common messages, and I have the ability to send a custom message if needed. Before I head into her house, I may want to check out some information about her past visits. To do this, I just tap on the circled number 3 visit, and I can see notes from her third and most recent visit. Here I can see all the completed tasks that the previous home nurse, Mike McLeod, had recorded. I can also call or text Mike if I have any questions about any of the tasks. Once I've reviewed, I just tap Done and return to the visit summary. Now I'm ready to go into the house, so I tap Start Visit. Once I start the visit, I can see the list of care tasks that need to be completed, just like I did for Sean. But here I can also see gray dots, which indicates that there's more detailed information associated with those tasks that's been documented during previous visits. My first task is to conduct a home evaluation, so I tap here. By tapping on the task, I can see detailed information noted as issues, and see that they've also been resolved. If I want to see the photo note left indicating that the stairs were an issue, I just tap on the camera icon to the left of that note. This shows the photo of the stairs before they were repaired. This page also shows me how to reactivate an issue, or add a newly identified issue by just tapping on the plus sign in the top right-hand corner of the screen. In this case, I'll decide to add a text note. Once I select text note, I just enter information about the issue. I can also choose to notify the care coordinator and the physician by sliding on the buttons below. So here we'll say that the house was messy. House looked messy. We probably don't need to share this with the MD, but we'll choose to share it with the coordinator. Once we tap Done, we can see that the new note is added as an issue, and it'll remain here until it's been resolved. I'll return to the visit summary now by tapping on the visit icon. Home evaluation now turns red to alert all home care providers that this is an issue identified in the home environment. This helps alert future nurses of the potential safety issue that needs to be acted upon. I can continue to work through tasks here, swiping left to complete them as I go. I can see completed tasks as well as active tasks remaining. Just as I did before, I can defer tasks, swiping to the left and marking them as deferred. 3 options are going to show up for me when I tap Deferred. In this case, we'll say that the patient refuses. Now the deferred task is showed in a separate category for analysis and to inform future home-based nurses. Another feature here is the option to reactivate a task in case I mistakenly swiped it as complete. All you have to do here is swipe over, tap Reactivate, and the task repopulates onto the active task lists. Another feature is the ability to add a task. To do this, you just go up to the top right-hand corner of the screen and tap on the plus sign. You tap in a task name, a description, and then you can have the task show up on any future visits if you want to make it recurring. An example here would be that Suzanne's son wants the nurse to follow up with her after each visit. So we'll type call son. We've made the task recurring, so we just tap Done, and now we can see that the new task is added to the task list. To see another example of the Notes feature, let's look behind Wound Check, since the gray dot to the left indicates that there's some additional content. Let's remember now that Suzanne is recovering from a knee replacement, so she has a large incision with stitches on her knee. One of the things that her visiting nurse will want to track is the condition of the wound and ensuring that her incision looks like it's healing properly. When I open up the note, I can see several notes by previous home-based nurses. Let's look at the photo dated from the last visit. I can look at this photo of the incision from the last visit and compare it with what the incision looks like today. Suzanne's knee looks like it's healing well, so I decide to add a photo note to show what the incision looks like today. All I have to do for this is tap the plus sign in the top right-hand corner of the screen and snap a photo. Once the photo has been taken, it'll be added just to this note, and we can refer back and forth between the two. Once the photo is added, I'll just return to the visit page and continue to work through my tasks. So we've finished Suzanne's visit with time to spare. If you look up at the countdown clock, it's only taken us 4 minutes. When we're done, we'll tap End Visit, and we'll be brought back to the landing page. With another visit completed, Home RN automatically shows me my next patient visit, Elizabeth Nairn. Since we've already shown most of the functionality, we'll just say that this visit was started and completed. Before I end my day, I may want to check back in with the scheduling screen by tapping on the clock icon in the top left-hand corner of the screen. Now all my scheduled patients have either been visited or deferred. This screen calculates total mileage, saving me the manual effort of adding and reporting. In addition, the deferred visit will be connected back to the billing system, so the visit's not charged inadvertently, and the 4 notifications can be followed up on by the care coordinator or the home service manager to close the care loop. When I'm done, I just tap Done and then sign out.